Welcome to the session, which is about cancer, pregnancy, and young children. And we're really happy today to have Pete Wallroth from Mummy Star with us, as well as Lisa Whitaker. Lisa is in Cardiff, and Pete, now I've forgotten where you are.
I'm in Glossop in Derbyshire, in Peak District.
Okay, I would have completely forgotten that. But
up north, but not officially up north.
Kind of close, north of London is
fair to middling, yeah.
Yeah. So this is a session that's very close to my heart. As a co-founder of Shine, one of the reasons that I found myself in this world is that I was diagnosed with cancer 6 weeks after my daughter was born prematurely. And I think for me at the time, and for most people who find themselves in that situation, cancer and pregnancy aren't two things that you know can go together. They're certainly not things that should go together. But one of the things that I discovered through my time working in cancer support is actually I wasn't alone. And I think a lot of people who find themselves in this situation do think that they are the only person that this has ever happened to. And cancer, I think as a younger person, is already really isolating, but cancer and pregnancy can be incredibly tough and isolating. So I'm just really grateful to Lisa and Pete for joining us. I remember when Pete started Mummy Star back in 2013, and actually how great I thought it was as a charity. And obviously it has come out of some really tough experiences that Pete's going to tell you about later. But I'm really just grateful to have them both here.
I think we first spoke the morning that there was a solar eclipse the last time. Because I'd been up for a run to go and watch it on the top of the hill, and I was trying to get back to the car in time because I knew I had a phone call scheduled.
And that's funny you say that, because I remember that day too. I think I was in the city of London. I was near Cannon Street Station, and it was getting darker. It was kind of a gray, overcast day because of the eclipse, and we had this, quite, intense conversation about some really tough stuff while we were both doing different things. But here we are, we're still here. So that's good news. So Lisa, I'm going to hand over to you first, because I know you also are in the Cancer and Pregnancy Club and had twins, which, I mean, if it's hard enough with one, I cannot imagine with two. But thank you for joining us, and I'm going to hand it over to you now.
Thank you, and thanks again for having me. It's really lovely to be here alongside Pete. And yeah, I'll just share a little bit about my experiences. So I was 33 and absolutely over the moon, but also slightly terrified to be expecting twins, as you mentioned. And I had a really great pregnancy, and everything was going well. But when I was around 7 months pregnant, I found a lump in my neck, in the front of my neck. And for anyone who has ever been pregnant, and certainly myself, you do experience lots of changes. So I wondered if this was just another pregnancy lump and bump, and wasn't quite sure what was going on. And then I went on maternity leave about 3 weeks before my boys were due to be born. And I thought, as soon as I was on mat leave, that this was a good time to go and get this lump checked out. And went to the GP, and my GP was absolutely amazing. I was heavily pregnant by this point, but she immediately, examined me and said, this could be thyroid cancer, which, as most people tend to do now, I had already Googled, so I knew this was, a possibility, but it still wasn't what I wanted to hear. But the GP made a referral immediately, which was extremely reassuring in the first instance. But then I found myself kind of caught in a bit of a strange situation, because for me, the only thing I wanted to know was what this lump was and whether or not it was cancer. And I wanted to know that before the boys came along. But everybody else, the consultant that I've seen, every other healthcare professional wanted to deliver the boys safely first and then figure out what was going on with this lump. So it was completely different perspective. And I really tried hard to get a diagnosis before the boys were due and before they came along, but I didn't have any luck. Nobody would would do that for me. So then, you know, was very lucky and grateful that Jack and Alfie, my twin boys, were born. And again, they became our priorities. And even though the worry of cancer and what was going on for me was still there, it was very much, you know, life became about feeding the boys, changing lots of nappies, and just trying to grab sort of 5 minutes sleep whenever we could. But then 6 weeks later, after eventually getting an aspiration and an ultrasound, I was diagnosed with thyroid cancer. And you know, I was on my own when I received the diagnosis. My partner was at home with our babies, and you know, making that phone call home to tell him was, you know, still one of the hardest things that I think I've ever had to do. Luckily, everything moved very quickly after that, and 10 days later I had the tumour removed along with my thyroid, and then my care was passed on to my oncologist. Recovering from more surgeries, I'd had a planned cesarean section with the boys, and then recovering from more surgery, you know, not that long after, and having young babies was really, really tough. And you know, for us as a family and us as a couple, you know, we very much just sort of had to get our heads down and just kind of try and get through each day. I wasn't sure if I would need any more treatment following surgery, and I kind of expected my oncologist to tell me what I would need and what was going to happen next. And the standard treatment, for anyone who's not familiar, the standard treatment for thyroid cancer is radioactive iodine, which is a type of radiotherapy, which means that you have to be in complete isolation for a period of time. And as I understand it, that can vary from person to person, but certainly, you know, the first few days and longer, when you have young children, you can't be around babies and young children. So after a long discussion with my oncologist and my brilliant Macmillan nurse, and with their support, I decided that I didn't want to have that treatment. I just didn't feel like I could be away from the boys. And then I was monitored every 3 months for 5 years, and I've very recently gone down to annual checkups because everything has remained fine, which is you know, absolutely brilliant. And I count myself really, really lucky, and I know that I've not been through half of what many people go through when they have a cancer diagnosis, but it has been tough at times, especially in that first year. And there's a few things when I was kind of thinking about, you know, sharing my story today and what sorts of things I wanted to highlight. There's a few sort of key things that really stood out for me at the time and have kind of remained, you know, really important, you know, even as 5 years has now passed, and maybe other people might be able to relate to. So the first one of these is just, you know, as I mentioned, my GP was absolutely brilliant, and I think my experience could have been quite different if she hadn't, you know, made that referral really quickly. And she told me that she had another patient who was in a similar position to me in terms of pregnancy and cancer. And I really think that made all the difference. And I think that sort of further highlights to me why we need to keep raising awareness of cancer in and around pregnancy, especially with healthcare professionals, so that they do, you know, consider that it might be a possibility, even when it's the last thing that the woman might want to hear. And for me as well, being able to have a say in what my treatment plan was going to be and what was going to happen after my surgery was very, very unexpected, but was hugely important to me. So I, you know, absolutely expected my oncologist just to tell me what was going to happen, but it was great to be able to feel like I could make the best decision for myself and our family, and with everything that was going on at that time. You know, I just feel like I wouldn't have been able to cope with the treatment at that time if I didn't definitely need it. And my kind of mental well-being and psychological well-being was really important, and it was great to just have someone take that into account and be listened to and have a say in what was going to happen. I think that's, you know, that's extremely important. As you've already touched on, Kindman, cancer in and around pregnancy is a really unique and complex experience, and following my diagnosis, I really struggled to understand what was related to my cancer diagnosis and what was kind of normal, for want of a better word, as a new mum. And it was really hard to think, you know, is this something that I should be worrying about and flagging up with someone, or is this just part and parcel of having just had twins and you know, little babies? So, for example, I was often asked about changes in my weight, changes to sleeping patterns and ability to get to sleep, appetite, mood. And, you know, I'd experienced changes in all of those areas and disruptions, and I really, you know, had no idea what they were linked to, or if I should have been asking for more help and support. So I think we really need to kind of understand a lot more about that, you know, and specifically cancer in and around pregnancy. It sounds like a really obvious point to make, but I desperately wanted the focus to be on my like beautiful baby boys and not on cancer. And I just think that I at times I struggle to prioritize my own health, because I just didn't want to be dealing with cancer, like nobody does, but especially when I just had these 2 little babies, and that's kind of what I wanted to be talking about and thinking about and focusing on. And just finally, the final thing that I wanted to say is that support from people who get it is absolutely key. You know, I was really lucky that I heard about Mummy Star from my NCT group, and I contacted them not long after I'd had my surgery, and I had a lovely reply from Pete, which we've spoken about in the past, but the first thing that he said was congratulations on having twins, and that was absolutely what I wanted to hear. And it was so reassuring to know that Mummy Star were there, that the support was there, that I wasn't on my own, that there were other people that understood. And because again, you know, we've already touched on it, but nobody wants a diagnosis of cancer, but especially when you're pregnant or when you've recently, you know, had a baby or babies. And charities like Mummy Star, you know, really help so much, not just in terms of the support that they offered me and that they offer lots of women and families, but in the raising awareness and educating healthcare professionals, so that, you know, people like myself, you know, I was diagnosed really quickly and really early, and, you know, as a result, I think that had a real positive impact, and I'm very, very grateful for it. And I'm going to stop talking now. That's my experience.
Oh, thank you so much, Lisa. I mean, I think, yeah, that's obviously congratulations on your boys. And how old are the boys now?
They're 5.5 now, and absolute rascals.
So yeah, it's funny because I think it's really tiring, isn't it? Having, you know, having a baby and then having kids that are 5, let alone 2 of them. So, and I think you're right, that can be really difficult to figure out, am I tired because I've had cancer? Am I tired because I've had a baby? Or am I really exhausted because you've got both? And unpicking those is incredibly difficult, isn't it?
Yeah, definitely. And thinking about, you know, does my medication need adjusted, or, you know, should I be sort of really trying to carve out more time for rest if that's possible, or is this just, you know, this is fine and this phase will pass, and, you know, and life will change again. It was, yeah, I just remember it just being really hard to know what to do and sort of second guessing everything, really.
Yeah. And can I just ask, so I mean, you obviously had a real inkling before you got the diagnosis that there might be something really wrong. So what was it like those last few weeks of pregnancy when you kind of had it hanging over you, and, you know, obviously wanting to prepare for the birth of your twins, but also thinking, you know, what if I do have cancer? I mean, that must have been incredibly difficult.
Yeah, and in lots of ways that was the worst part. And, you know, other than my partner, I didn't tell anyone or talk to anyone about that, because I thought, well, until I know for definite, then it just, again, I didn't want anything to kind of take away from preparing for the boys arriving. But yeah, the not knowing, you know, and most of my experience and the care that I had was exceptional, and I can't fault it. But you know, having that initial appointment with the consultant before the boys were born, you know, he just looked at me across the room and said, it's probably nothing. And I don't know if he was, you know, let's give him the benefit of the doubt. I don't know if he was trying to be reassuring, if he thought that was. It certainly wasn't. That's not what it felt like. I wanted to know one way or the other. And, you know, and like I said, I did try really, really hard and kind of bounced around between departments in the hospital for quite a long time, just trying to get a diagnosis before the boys came along. But it wasn't possible, so then I just had to try my best to focus on them, and you know, and once they arrived, it wasn't that I wasn't worried, but I didn't really have time to, you know, think a lot about that really. And then, you know, obviously I knew I had an appointment in the near future, so yeah, it was the kind of unknown, the not knowing, that was one of the hardest bits. And I just think for me it sort of highlights the difference sometimes in what a woman like myself wants and needs, and what health professionals are saying is the right course of action, because often, yeah, those can be different, and it's really hard to kind of go against that and try and get them to do things differently sometimes.
Yeah, absolutely. And especially when they've got a sort of, I guess, a path and an approach that they take with people who aren't pregnant or don't have young children, that can be very different. Your priorities are different, aren't they? So one of the things I realized I didn't say when I was introducing you was that you have a PhD from the University of Stirling, and you do a lot of research and public engagement work. So which came first? And do you think those two have sort of reinforced each other, you know, your experience and your work now?
Yes, so I did my PhD quite a long time ago, and I absolutely loved it, and I love research, but I just never see myself as an academic. I didn't think I was properly cut out for that world. But I'm such a strong believer in people with lived experience having the opportunity to influence research, and that's kind of what led into sort of some public engagement work, and also working for some, you know, amazing cancer charities, including Mummy Star. And you know, it's through all of those different experiences, I think the kind of common thread is just being able to bring, you know, people who, not just cancer, I work with some different conditions now as well, but just bringing researchers together with people who can tell them what it's really like, you know, and ask the questions and shape research and help to identify the future of research and future priorities. That's something that I'm really interested in and really passionate about. I think it's really important.
Yeah, absolutely. And I think, you know, it's, when you're in that situation, you really need people to listen to you and support you to be a parent as well as a patient, don't you? I mean, I know from my own experience, I spent 6 months in the hospital after I was diagnosed. So my daughter was tiny. I would think she was 0 when I was diagnosed, because she was 6 weeks early, and I was diagnosed when she was 6 weeks old. But I can remember them at the hospital saying, oh, well, we don't have babies on the hematology ward. And I was like, okay, but you have to have this baby in the hematology ward. And, you know, it was a real, I think they were really kind of, they struggled. Obviously, in the end, they made the right decision and said, yes, of course, you know, your baby can come in, but it wasn't something they were used to. And obviously, babies can bring infections. I mean, we were more worried about her picking something up in the hospital, but yeah, it can be a real struggle to get those messages across, I think.
Yeah, definitely. And I think that's why, you know, there is being more research done now, which is going to influence and improve practice and care and kind of raise awareness of lots of these experiences. And I can't imagine what you went through. But we need more, and we need to keep doing more research, and understanding, and being able to change things for the better, I think.
Yeah, absolutely. So thank you, Lisa. I've got more questions for you, but I'm going to go to Pete now, because I think actually when you talk about, you know, the research and the education piece, this is something that Pete has done so much of. I'm just going to make you a spotlight. Sorry, I'm spotlighting people all over the place.
You don't want to be spotlighting this face today.
Yeah. So Pete, tell us about your facial hair, first of all.
Oh, remember, it's Movember.
I
think it's always take part. Just, I think, yeah, I've always been, you know, a talker anyway, and kind of part of my I suppose journey with Mummy Star has been, I suppose, learning the hard way, learning learning, fast and hard about how, cancer can change your family structure that you take for granted and what you've got used to, and also, the impact from a partner's perspective. I've never had cancer. I'm very grateful that I haven't had to go through that experience, but I've, sadly had to watch a loved one go through it, and what led to Mummy Star ultimately getting set up was the loss of my late wife Maya back in 2012 through a diagnosis of cancer in pregnancy, which is, I think, as Lisa and you pretty much summed up, it's that thing of oh, is that a thing? Is that something that can actually happen to people? Because I suppose me and us as a couple, as many others, I think we hold, I suppose we hold pregnancy is quite sacred and quite untouchable, even though we know anything that can happen to the human body, sadly. But I think cancer is one of those things that just seems to be so contrasting with the raft of emotions that that people go through as individuals and as couples when they get pregnant, that you just don't see how something as destructive as cancer can come into the same space and time. And when it happens to you, whether you come from a medical background, whether you've got some knowledge of that area, or you come from a totally different area of expertise, I think it knocks you sideways, because I think it takes you out of the comfort zone of your what ifs and buts and maybes. And even when we've all been touched by cancer inadvertently. I think you struggle now to find anybody who hasn't had more than 2 steps apart known somebody who's been diagnosed. And you hear of other people's experience, but it often feels quite peripheral, even though you might be people that are close to you, like grandparents and uncles and aunties, which was my limited experience. But all of a sudden you get diagnosed and it's like, oh God, it's us. Well, what the hell does this mean? And we're 20 weeks pregnant, but what happens to the baby? And are we able to continue? And what happens to you? Or does this mean it's treatable? Are we going to be able to have treatment? So I think there's a whole raft of emotions that you go through as a couple. And I suppose the timeline that I followed over the last 10 years has been one of obviously learning about an area that I had no previous history in. But I've also at the same time had my own personal development journey, which is one of, I suppose, survivorship in the sense of coming from bereavement, and walking through that journey as a parent with very young children, and how the mental health journey emerges with that as well.
Can you tell us a little bit about that journey with Maya, with your wife at the time, and what happened that kind of led to the founding of Mummy Star?
Yeah, so we were as a couple, we already had a little girl who was 3 at the time. We got pregnant again. We were overjoyed, and as the pregnancy continued, she got up to about 17, 18 weeks. And at one stage, she started feeling a discomfort in her left breast. Didn't necessarily put it down to anything suspicious. Just thought, we'd breastfed, with our first child for nearly 14 months. So presumed, that it might be just something to do with breast activity heightening in the body again, milked up, milk production, starting. We didn't know. We were just kind of guessing a little bit, really. And it was only then when we went for a scan, we found out we were going to have a little boy, went to the scan, had a routine appointment with the midwife afterwards. And she mentioned this to the midwife at the time. And this is subsequently, as time's gone on, has become really key from an awareness perspective. She just mentioned it in passing. And the midwife, rather than palming it away, very much did what Lisa's doctor did and said, right, it probably is nothing, but nonetheless, I'm going to get you referred and checked to the breast clinic anyway. And I thought, right, okay, that's fine. Better to get it checked. We weren't overly worried. And then Maya subsequently went to this appointment, 3 weeks later. And, like Lisa, touched upon with her own experiences, I can still remember the phone call where Maya went to that appointment on her own because she wasn't really that concerned. I went to the park with my daughter, and then this phone call came through within 20 minutes where she said they've examined me. They think I've got breast cancer. And, at that point, you go on this total about turn thinking, well, how the hell does that happen? It's just you're pregnant, and suddenly you get this raft of questions coming out of your head, in quick succession. Now we, again, from a care perspective, we were really fortunate. We had a great team around us who were very quick to reassure us and said, yeah, despite the fact that this is a massive shock, there are treatment options available. You're well into your second trimester. Because of the type of breast cancer it was, there was treatment that was going to be perfectly safe during, well, I say loosely, perfectly safe. There's always obviously risk with any form of medical treatment, but in terms of safety parameters within pregnancy and its lack of impact on the on our unborn baby, it was going to be okay for her to proceed with rounds of chemotherapy during pregnancy, and then she would proceed again afterwards. But that nonetheless, with those reassurances, you still worry. It still rallies against your innate instinct of, but we're going to have cytotoxic drugs and you're pregnant. How does that not? Yeah. How does one thing not cross over the other? And
people don't even want to take paracetamol, do they?
So, yeah, exactly. Yeah. And so it does. It just, they seem, like I said earlier on, totally contrasting things. I mean, again, I've subsequently learned that cytotoxic drugs don't cross the placental barrier, so you are in fairly safe ground in terms of treatment, but radiotherapy you obviously can't. But we went through that, and everything was fine. But I'd say the bigger impact for Maya was learning things like she was no longer going to be able to breastfeed again because of the impact of the chemotherapy, and that had far more weight in terms of emotional impact on her than the actual cancer diagnosis did, because she saw breastfeeding as a fundamental part of her bonding, with our baby. So why couldn't we do that again? Why was that going to be, essentially stolen from us because of this experience? And it almost became irrespective of what happens with the cancer, that part of my birth is not going to be there this time round. And I think that in isolation could have been left, and that could have become a real point of, dwelling and worry. But again, because we had such quick responses from infant lactation consultants and the midwifery team that were around us, there was this real rallying of, for everything that gets taken away, we are going to do our best to try and replace it with something positive. So, taking away breastfeeding brought in a conversation about accessing donor breast milk. Again, never heard of it in my life, didn't even know it was a thing. And all of a sudden we were like, wow, this is a whole world of amazing goodness that people do this and people donate breast milk, and in our situation you can benefit from that. So you feel it's not a feeding conversation about do's and don'ts. It's just, if that's my preference, then yes, it's good to be able to have the option, and that people are willing to do that. So we had that as an offset. It took away some of the stress, not all of it, but it offset some of the worst of it. And then going through chemotherapy in pregnancy, there's all that anxiety that wells up. First appointment, having to stop the car about 4 or 5 times because she was just physically sick with anxiety. And then the midwifery team again picked up on this, knitted it all together and said, well, look, why don't you just come into the maternity ward on the way into the hospital before chemotherapy, and you can listen to baby's heartbeat, and then you can just go for chemotherapy afterwards. And again, little things like this, as we've learned over the years, they make a massive difference in terms of flipping somebody's outlook on a situation. So it became about, those experiences became about baby appointments rather than being about cancer. So when you ended up going into the hospital, your perspective was actually one of excitement and looking forward to it, and we managed to have that for the remainder of the pregnancy. Merlin was delivered safe and well. She was induced at 37 weeks. He was delivered, he was 7-pound healthy baby. But then this, going into some of what Lisa said, she then recommenced chemotherapy within 6 days of giving birth. Wow. And she was absolutely flattened by that. But you then end up in this realm of, well, which of this is birth fatigue, that you would expect that anybody would be absolutely, shattered by completely. But which of this is chemotherapy fatigue? It's impossible to tell the difference. And then you're trying to look at, when we talk about people's cycles in recovery of chemotherapy, where you have a day where you're high and all on your steroids, and then you have this slump, and then you slowly emerge from that fog 4 or 5 days later. It's nigh on impossible to pick apart which is which, post labor. And I think those are some of the things that, like Lisa said, it's so difficult to pick apart both the physical impact, but then there's also far more impactfully is the emotional impact as well. Is if I'm tired, if I'm not feeling like I should, like we hear so many of our families talk about, I feel guilty, I feel like an awful parent, I feel lazy, I'm not doing as well as I should be doing, or I'm not offering my baby now what I offered our first child. So all that emotion is wrapped in. And again, there seems to be still sadly, very little safety netting around that to say, right, hang on, people in this situation are probably far more prone to suffering things like postnatal depression because of how much the bonding has been interrupted, how much their own experiences of their own physiological pregnancy has probably been changed. or how that feels postnatally. And it's then that, well, how do you pick apart how you should and shouldn't feel, or where do you set your bar? Because, you know, let's face it, in a world where we're covered by parenting apps and mags and this, that, and the other now, there's so much depiction of what you should be like as a, you know, as a postnatal parent. Well, how that doesn't match up with cancer diagnosis. That doesn't, you know, we can't have those experiences, and you don't necessarily have that shared experience as a couple, you know, sort of, I think, you know, drawing back onto that experience. It's what you look forward to as a family, like, you know, going around the park with baby for the first time, when you're, you know, you've got over that initial nervousness about, oh my God, what's going to happen if baby goes out into open air and we've got the pram. And it's like, well, we can't do that because she needs to be in bed, so I'm going to do this on my own. And that bites, you know, slowly, that really does bite in over time. You're thinking, this is something we were looking forward to. And that's when the shared experience then starts to think, actually, this isn't about just the person who's been diagnosed with cancer. This is, there's a filtering effect here that's going to, that goes across the wider family as well.
And I think one of the things that I know you've spoken about a lot actually is the mental health impact on the partner. So obviously, you know, there is a huge impact when you're the person going through treatment, but sort of watching your partner go through this. And I know that Maya passed away from cancer. I don't know how long into.
Merlin was 10 weeks old when she died.
Yeah, so then you're left with a tiny baby. But what was your experience of watching that? And then how did you get to a point where you recognize, you know what, I'm going to need some help. This is really tough.
I think within a few weeks of Merlin being born, and Maya had, I think she'd had one, possibly she was into her second round of chemotherapy postnatally. I think what I found myself going through was, I knew he needed me and I knew he had his needs, and, you know, as any baby does, but I was really struggling to prioritize his needs over hers. Like, all I wanted to do was make her a cup of tea, bring her some toast, and just have a lie down with her. Just, even if she was just out, you know, out for the count, I just wanted to be there with her in that space and time and just be present. But I knew he needed me, and that affected my early bonding with him. That really affected, because I saw him as something that needed to be done for, rather than somebody that I was really looking forward to, you know, sort of being in that moment with. And it was only, I think I did that thing that I've learned, you know, so many men in particular do think. It's not restricted to purely male partners, but I think it ties in with the issues we have around, you know, male mental health and men, you know, actually reaching out for support. Was I didn't realize that me struggling had become so visible to the point that it was actually causing Maya anxiety, because she could see how much I was bottling up and she could see how much I was struggling. And eventually it came to a point one evening where I just crumbled on the sofa, and then I think we both just had a really good cry and hug together. And it was at that point then that I, you know, reached out for, you know, for some counseling. I said, look, there's obviously things that I'm really struggling with, you know, with this to contend with. But I suppose that, you know, that in isolation, I'm not naive enough to think that's a typical picture. I accessed support when I needed it as easily as I did, because I've had counselling in previous years in my life. It's something that I'm very open to. So I always accept that is not easy for a lot of people. You know, that could be many people's first jump to trying to reach out for support. And it's like anything, admitting you've got a problem is the biggest part. Once you do that, then, you know, it becomes slightly easier as the steps go by. But you know, seeing the different stages of struggle, and where you were not necessarily angry with the world as to why this had happened to us, but trying to pick apart how it happens. You know, we didn't have any blame to find. Nobody was at fault for why it had unfolded the way it had, which I think sometimes gives people something to go after, you know, when they're struggling with, you know, with something like this, which, you know, I've come to, you know, to realize, I mean, it's essentially birth trauma for partner and for, you know, and for the person who's been diagnosed, because you've been told something in pregnancy or postnatally that could, you know, could kill you. There's no hiding away from that, but we don't see it in that typical sense. If we did, it would probably have a support network alongside it that would see it for that, in the same way that we do see other forms of trauma in and around, you know, sort of birth and pregnancy.
Yeah, I mean, I very clearly remember having a thought where I thought, would it be better for me to die now so my daughter never remembers me? or for me to live for a while and for her to have some memories of me if I'm going to die anyway. And that's really, I mean, that's a horrible, you know, for anyone, that would be a horrible thing to go through. But I think actually that's what I have heard other people who have been through this say the same thing, because obviously I think like Lisa spoke about, and you as well, you know, that the attention should be on the baby. And certainly when you have the baby, you know, I was thinking, what's best for my daughter? What would be the best thing for her? Maybe it would be to never even know I existed, and then she doesn't have to live through the trauma of losing her mother. You know, it's a really tough thing. And I think actually that's why Mummy Star is so important, and the networks we have through Shine as well, because people can discuss this stuff. And it sounds really horrible. You know, you say that out loud, and to most people they go, oh, that's a bit harsh, but that's the reality of it.
I've heard and spoken to many women over the last 10 years who have shared thoughts like that, where they willingly choose to not bond, or well, I should say that they think they're choosing not to bond with their baby, even though the baby will be bonding with them. I think what they have perceived as actively trying to bond, and they thought, like, you know what, I know this is probably going to end up, no matter what I'm getting told, no matter how much reassurance I have, exactly that thought. What is the point of me being here? Because it'll just make the tie break. When the tie breaks, it'll just make it harder for them. I think the way we've always tried to provide support in, you know, to counter that feeling is almost to say to people, try and chop up those development months into chunks of really small periods of time. So that I think sometimes when people are trying to pick apart what couldn't happen in the future, people reach out and they grasp for, oh, I want to be here for that first day of their schooling, I want to be there for graduation. And we've always done is, like, we have no control over what sadly will or won't happen to somebody's cancer diagnosis. But if we try and reel it right back to actually look at the first roll, look at the first murmur, look at the first babble, you know, and bring it right back down to the things that happen on a weekly or daily basis, rather than trying to go, oh no, but I've got to get to there instead. It's like, yeah, but we've got treatment to get through before we get there. You know, the first birthday is where it is, and it's not going to go anywhere. It's a fixed point in time, but we can concentrate on, you know, on now. And again, a lot of this isn't really that different to parenting without a cancer diagnosis. But I think when we have a cancer diagnosis thrown into the mix of it, I think we stop looking at it in the way that we just do as parents. And I think, yeah, one of the benefits, you know, that we've been told about over the years, and what we've always aspired to do, is bringing the focus right back onto the fact that, hey guys, look, we're all in this bubble together because you've either had cancer in pregnancy or postnatally. But when you strip it all back, you're all parents, or you're all pregnant, or you're all wannabe parents who maybe sadly have lost a child or have lost a baby as a result of your cancer diagnosis. So validating all those feelings that you have as parents, as prospective parents, validating the bereavement that people feel, and that loss and that heartache that people go through when they, you know, perhaps have to have, you know, terminations for medical reasons. It's validating it is I suppose probably one of the biggest things that we're able to offer. You know, and people seeing how they feel reflected back at them, and people being met where they are at in their situation, rather than somebody placing a template over them and say, this is what we offer, how are you going to fit into it? And it's like, no, it's like, where are you? What's working for you at the moment? Where are you finding the struggles and the gaps? And then we try and knead our way into that in the best way that they're going to find most helpful.
Yeah. So tell us about Mummy Star and what you do through Mummy Star.
So it's a range of it's a really personalized support model. So it's a range of like emotional and peer support. So access to the like emotional support forums where you've got hundreds of other families that we've supported, you know, very irrespective of type of diagnosis, gestation, staging, whether, you know, people are primary or living with cancer. So you've got that instant connection with other people who understand, you know, the emotional and practical challenges that you're going through. But equally within the team itself, purely by fortune, I guess, we've ended up with people who want to join the team because they've had that lived experience, and they want to be able to offer that, you know, to other people, you know, who find themselves newly in that situation, so that they know that the voice they hear back is one that actually genuinely can say, I understand what you're going through. And I'm always cautious in that. It's not something I ever say to people, because I don't understand what it's like to be diagnosed myself. My perspective is that, you know, that we've just been talking about in terms of from the other side in. We offer some small grants to families to be able to, non-means tested grants, to be able to take the edge off some of the additional costs that can creep in, whether they're, you know, preparing for baby's arrival because the diagnosis has happened and suddenly they're just like, oh my God, we haven't even got the nursery ready yet. And then there's a mild panic. Transport costs increasingly at the moment, you know, it's basic things, cost of living, food, fuel, you know, anything that creeps in really that adds that extra stress, you know, with any cancer diagnosis.
Yeah.
A lot of advocacy, you know, with and on behalf of our family. So if they're finding obstacles, you know, ensuring that they get informed choice during their pregnancy or postnatally. You know, if somebody's got a birth plan that they were wanting, you know, to really have a home birth, you often get this narrative emerging where, oh, well, they've got cancer now, so they need to be in the hospital. And we will actively challenge that and say, well, why? Why does having breast cancer preclude somebody from having a baby at home? There's risk factors in home birth anyway. It's not just because they've got cancer. So trying to, you know, work with the professionals around them, work with their midwifery teams and consultants to say, look, this has got to be person-centered. It's not about your comfort zone as a clinician. It's about centering it on that person and what they want for their birth experience, because what we want them to remember is, despite the cancer diagnosis that they've received, we want them to be able to leave that situation knowing actually that they reflect well on that pregnancy was actually wonderful, or there were things that they can draw back on and think, I really valued being listened to during my pregnancy. I valued my preferences being adhered to. I valued feeding choices being discussed with me, and I valued my treatment plan, like Lisa, you know, mentioned earlier. Actually explaining to somebody what the treatment plan is, why it's going to happen that way, but more importantly, why that is best for their outcome from a cancer perspective. And I say that, it sounds like semantics, but there is a big difference between that versus being told what's going to happen and feeling like you're being done to as a parent, irrespective of. I've seen many people with really positive cancer outcomes, and the ongoing trauma they suffer from is that feeling of having never had any choice, irrespective of the fact that they had a positive outcome. And equally, I've seen many people sadly die over the years or live with secondary cancer, but their reflections on their pregnancy experience are so positive because they were the center of it all, and that's what we aspire to. And what goes hand in hand with that is the ongoing education and awareness, you know, that we provide. So delivering guest lectures like study days and teaching sessions with university students, a lot sort of weighted in midwifery, but with other health professional disciplines as well, to broaden their understanding of the fact that cancer and pregnancy is inevitably, sadly, something they are going to come across in practice, and more so they're more likely to see it as birth trends, you know, shift more and more into the late 30s, early 40s. It's only more likely that they will see cases, not because there's causation between the two, but because just as people leave it slightly older to start families, they're going to end up overlapping into some higher pregnancy bracket, higher cancer risk brackets, such as like breast cancer. We know the risk starts to become slightly higher. Doesn't obviously stop it from happening. You know, we've supported families as young as 19, 20 with a cancer diagnosis in pregnancy. But again, with those situations, you have a different dynamic because they're so young. They may not have, you know, roots and a family structure around them. So that's where they find the structure, the struggles, rather than necessarily, you know, the practicalities of dealing with the cancer on an ongoing basis. So yeah, it's a mix of support, financial aid, advocacy, and education and awareness. Trying to just open the conversation up.
It's within 12 months of giving birth that you.
Yeah, so a diagnosis of cancer at any stage during pregnancy, whether that pregnancy goes full term, or families who lose that pregnancy for any reason to do with cancer or otherwise. But if a diagnosis happened, and a diagnosis up to 12 months postnatally as well. But once those families are in touch with us, they're in touch with us and will be supported by us as long as they choose to stay in touch. It's a timeless support.
Great. And I mean, I know in Shine, because of the people we support who are 20s, 30s, and 40s, and I think there's a flow between us actually of people that we've supported, because we do have people who had cancer in pregnancy, or similarly, you know, cancer diagnosed just after birth. And then we have a lot of people with very young children as well, who, you know, maybe their kid is 18 months old or something. And so we support them as well. But Lisa, I just want to bring you back, because one of the things that Pete talked about is, you know, the thoughts around bonding. And I mean, I know this is a big thing for people, and it's tough. I think, Pete, you talked about, you know, the narrative around pregnancy and bonding, and, you know, there's lots of beautiful pictures and stories and, you know, all of this sort of ads out there for motherhood. And when that's not your experience, it can be quite tough. So I'm just wondering, how did you find it? You know, looking after two babies is tough at the best of times. So to have cancer on top of that, how did you find developing your bond with them?
Yeah, I mean, the bonding, was a huge reason why I didn't want to have any further treatment. And of course, if I had been told that that's what I needed, then I would have done that without a doubt. I mean, but it was a huge sort of source of concern, because as a completely separate issue, not related to my cancer diagnosis, but I had a few days away from the boys when they were first born, because I was a little bit poorly myself then, and so I'd already had a bit of time away and felt like I wasn't there right at the start. And then, to think about spending even more time away from them, I just really felt it would have been something that I'd struggled with, because I, as I said before, I just wanted to focus completely on them, which, on reflection, probably sort of meant that I was a little bit too clingy and needing towards them, if you know what I mean. Like, I really didn't want to let them out of my sight at times, which, I'm quite happy to now. They're having a lovely time at school. And so I think it took us a while just for things to settle down a bit and to kind of find a bit more of a just healthy balance that worked for us as a family, because I did sort of cling to them, and really felt like I didn't want to be away from them, and felt extremely guilty and extremely anxious whenever I was away from them for any length of time. And yeah, I mean, it just having the two of them was a challenge as well. But also sort of recognizing that going out to sort of mums and babies groups and kind of meeting new people, it did feel like, especially in those early days, that I was also dealing with something that I chose not to share with many people, and it took me a long time to be able to talk about that, because I did feel like I had just so much more going on in my head. But yeah, bonding, as you said, was just a huge focus and concern for me, and I was extremely grateful that I didn't need to have that, that further treatment, and that I could choose not to have that, so that that I could have all the time with the boys that I needed at that point. But I certainly felt like, and I know it's something that Mummy Star have spoken about as well, my maternity leave was hugely taken over by my cancer diagnosis, and I really felt like I wanted another maternity leave. As much as I loved my work and and was keen to go back to work, I really felt like I wanted more of that time. And actually, as bizarrely as things worked out, I was furloughed from a previous job during lockdown, and that was, I know the pandemic was horrendous for many people, but for me, selfishly and personally, it was really lovely to have that time with the boys where I wasn't focused on, anything else. We couldn't go anywhere or do anything anyway. It was just nice to have that little bit of time, which felt a little bit like a second maternity leave, because it's such a shame, and it's so hard for women and families when that precious time is completely disrupted and taken over by a cancer diagnosis.
Yeah, and you're kind of just, I mean, we're lucky in the UK that you can get a year. I mean, if you can afford it, you can take a year off. But, I know in my case, the best part of 6 or 7 months was taken up with being, in the hospital. And then you get out, you're just starting to recover. And it's like, okay, now go back to work. That's really tough. But we also know, we've done some surveys at Shine, and I can't remember the statistic off the top of my head, but there is a big percentage of people who told us that they feel their relationship with their children has, I think the words we used was been negatively affected. But what people said was, it's because they feel exhausted and they feel worried. So it's not that, something's happened, the relationship's broken down. It's that this cancer diagnosis has made them worried that they're not being good parents. And I think, Pete, you must come across that quite a bit, but it's one of the things that we talk about is, actually, sometimes being a good parent is just sitting on the sofa and watching TV. If that's what you can manage, that's what your kids need, isn't it?
It's such a common conversation thread, again, we touched upon perceptions of what if you've had another child already, you obviously have your own benchmark that you've maybe inadvertently set yourself, so you can almost set yourself up to fall by putting yourself against that. But it is that what should we be doing, and how should it be perceived as well. But I think it is the days where I think where the impact is people say, all right, you could be down on the floor with your baby and playing and this, that, and the other. But sometimes lying close to the floor when you're that fatigued can actually make you even more nauseous. And it's those take for granted things that you think, actually, do you know what, that's really tiring for somebody. And I think it's almost the congratulations needs to be, you know, well done on being able to actually get up today, because that's where the benchmark should necessarily be in these situations, rather than rather than what you feel. And then there's also, I think, what plays a factor into it as well. We talk to people all the time about trying to energy bank, if they can, is they come out of, say, you know, chemotherapy regimes, and they suddenly feel better, and then they go hell for leather to try and do everything that they've not been able to do for the last 6 days, and they end up totally crashing as a result of it, rather than saying, right, try and just do a little bit of tomorrow and then a little bit the day after, but don't try and race around. You know, we understand that people start to suddenly question time and how much you should do, because life's so short, and obviously, you know, nothing more than a cancer diagnosis ever brings that, you know, so vividly to the fore. But from the children's perspective, they're not in a race to necessarily, you know, sort of get everything done in one fell swoop. They might change the retention span from one minute to the next. And like, Lisa, I don't know how you did it with the two of them, because when we had mixed age groups, they occupied each other. I don't know how you coped in COVID, but I can totally get the perspective on that, in terms of, you know, we're parents at the end of the day, and you know, I think if we're able to hear somebody validate that and remind us that at our core that is what we are in the situation, I think sometimes it does offer a really good leveler, and people actually sharing the small things. Lisa shared, I think, a few years ago, that I've subsequently shared with quite a few other families, is it 5 Minute Mum, Lisa? You know, and it's really simplistic stuff that you can do in the house. So you're not having to go out and buy loads of stuff and this, that, and the other. But, you know, not just from a COVID perspective was it a really, really great idea to be able to occupy children, but in our setting, it's, you know, it's great because they're not really that intensive, the kind of things and exercises that you could do, or you know, little activities that you could do with children. And, you know, it all helps sort of, you know, break up the days, and also always bring a reminder back that, do you know what, I might be doing something that I personally feel isn't much, but to that little child or that little baby, that will have made a massive difference to them. You might just not see it visibly, but you know, if you ask somebody, you know, who knows this stuff well enough, that cognitively that will have made a massive impact on that child. And yeah, it's the unseen things that are making the biggest difference, but that sometimes is the hardest thing for us to recognize, you know, ourselves as parents, and we're all our worst judges.
Yeah, no, absolutely. And I think that, you know, I can remember when I first got out of the hospital thinking, okay, well, I got to take my daughter to a cafe because that's what people do, and walked something crazy like 4 kilometers to this cafe, and then 4 kilometers back, and then thought I was actually dying that evening because I felt so terrible. And going to see my hematologist the next day, and him saying, no, the reason you feel terrible is not that the cancer's come back, it's that you walked, you know, 10 kilometers yesterday. You can't do that. But I thought, no, I mean, that's what I have to do. And in my mind, I had this vision of, you know, living in North London with my baby in the pushchair. And yeah, when you find out that's not going to be your experience, that was tough, but it was a really good thing for him to tell me is, exactly, energy banking. You've got to pace yourself because actually your experience is different than what you see. And
absolutely.
And yeah, just sitting on the floor. I mean, all kids really want is your love and attention. And if you can give that to them, even if you're lying flat on the floor because you feel terrible. Yeah. They don't mind. They're happy you're down there with them.
The entire Disney back catalogue.
Yes,
it always
exactly.
has its place.
That's right. So I just want to finish up. I know we're almost out of time, but these, I mean, Lisa, your story does, you know, you're living happily. Your boys are happy. It's a kind of not an ending, but it's a happy middle that we're in, I hope.
Yeah, definitely. I like I said, I count myself very lucky, and yeah, it's just a nice time to enjoy them at this age now. So yeah.
And Merlin is how old now, Pete?
Merlin's 10 now, so yeah, it's a kind of a funny time at the moment because he's just turned 10 in September, which inevitably obviously means that, you know, that his mum's 10th anniversary is coming up around the corner as well. But he's doing really well. You know, he's a really healthy young lad. His sister's, you know, 13 going on, God. Anyway, teenagers. And then I I got married 3 years ago, and they have a little brother who's 4.5 now as well. So so it's like a really, really lovely, knitted, family. And there's no, I talk about this sometimes, there's no step in our family. They're just brothers and sisters. There's no, nothing, we don't have that kind of structure in our life. It's just a very fluid family. And interesting conversations are starting to come up from the littlest voice in the house about, is that Merlin's mummy, and and what happened and this, that, and the other. But they're inevitable conversations. They're part of how we're evolving as a new family structure. And yeah, there's a bit of trepidation there, but equally it's something that that we welcome, because we've always been open. We've always openly cried. We've openly talked about Maya and what happened. I don't, anybody who knows me knows I don't hide away from, my own struggles over the years, but that's to the benefit of me. And it subsequently then is to the benefit of other people as well, to be able to talk about it. And I think I probably mentioned the word several times now, but validating experiences for other people in the same situation. So yeah, it's been a very, what feels like a very rapid 10 years at times, but it sounds like always an odd description to use, but I feel very fortunate that the care that we had was as good as it was, that the reflections on some of the pregnancy are as positive as they were even now, and that, life has unfolded since that tragedy in a positive way, for us and our family. And I think the biggest benefit for me from Mummy Star is, like Lisa and I, we've become really, really close friends over the last 5 years. And, that's one of the biggest benefits of this. You just get to meet so many amazing people, and and count yourself very lucky, because you wouldn't have met those people.
Yeah, absolutely. And I think, Mummy Star is a great tribute to Mara and to you as well. And it's just great to know that your family's doing so well, and you've had another little one. And, I think it's nice to see that there is kind of life after the diagnosis as well, because that's really important for people to know. So thank you guys so much. I'm going to stop recording now. But if anyone would like to get in touch with Pete, he is at mummystar.org.
Yeah, Pete at mummystar.org.
And Lisa, you are on Twitter, I think, aren't you?
Yeah, too much of the time. But I've also there's been some really nice comments in the chat, and I've put my email address in there as well. So yeah, feel free to get in touch anytime.
Great, thank you guys so much.
Thank you.
It's a pleasure. Thanks for getting us on.